I'm Jennifer Davis. I'm an occupational therapist at Joy and Laughter Developmental Therapy. Today, I'd like to talk to you guys a little bit about primitive reflexes, what they are, what their importance is, and how they can impact play, education, and attention in children. What are primitive reflexes? Primitive reflexes are the automatic responses that children develop in the early years of life that are essential for their survival. They help newborns with their functioning, like how to eat, how to protect themselves, and how to develop some of their motor skills. But when these reflexes don't integrate and go away as the child gets older, it can produce challenges for them as they continue to grow. Some examples of primitive reflexes that are super helpful for children include the rooting reflex, grasp reflex, and startle reflex. These are very important for small children, but can be impactful for children who are older and trying to learn how to play. As a child matures, these reflexes typically integrate into the nervous system, which allows them to become less prominent, allowing the child to control their movements more voluntarily. However, if the reflexes are not properly integrated, it can lead to challenges in various areas of development. When primitive reflexes persist beyond infancy, they can have a significant impact on the child's ability to learn and engage. Children may experience difficulties with attention, coordination, and social interactions. Unintegrated reflexes can manifest as challenges in focus, maintaining impulse control during play, and even in processing sensory information. I'd like to tell you about the 3 top reflexes that are impacting a child's attention and play. The first reflex I'd like to tell you about is the Moro reflex. This is often also known as the startle reflex. The Moro reflex can be triggered when there's a sudden loss of support or a loud noise. This will cause the child to throw their arms out and then back in. If not integrated, this reflex can be associated with anxiety with movement, difficulties with transition, and making it hard for children to focus in the classroom. Many of our children who have difficulties with postural control can have increased difficulties with the Moro reflex because of that loss of sudden postural control. If a child is having a difficult time moving and they then accidentally get their head put back, it's going to trigger this reflex, which will be very startling and hard to participate in play. So when you have a child who's struggling with that, that could be part of the problem. Another reflex I'd like to tell you about is the asymmetric tonic neck reflex. This is often abbreviated as ATNR. The ATNR reflex is when a child turns his head to one side and it causes the arm of that side to go up and the other arm to move into a flexed position. This is often known as the fencer's pose. If retained, this can affect a child's ability to cross midline, which is essential for bilateral coordination. If every time the child turns their head to look at a toy over there, and their arms start to move without their voluntary control, it makes it hard to participate and play with that activity. This can hinder a lot of tasks, including handwriting skills, participation with small objects, and general coordination for games and activities of childhood. The third reflex I'd like to talk about is the spinal galant reflex. This reflex is triggered when the lower back is stroked, causing the child to arch his back. If retained, this can lead to restlessness and difficulties with sitting still. Oftentimes, children who aren't sitting still in their chair aren't choosing to be antsy. Their reflex for the spinal galant keeps getting triggered, causing them to be restless in their chair. This can be disruptive to learning and also interfere with social interactions and playtime. Children might find it hard to concentrate, which makes it easy for them to become distracted and more challenging for their educational experience. In conclusion, primitive reflexes are vital for early development. When they're present in early adolescence and infancy, they can be a great support for children learning skills. As a child continues to grow, many of these reflexes, if still present, can have an impact on a child's If these reflexes persist past infancy, it often can have an impact on a child's participation in play. It can also affect their social interactions, general organization, and their ability to engage in typical activities of childhood. If you're noticing that your child is having difficulty with any of their primitive reflexes, Reaching out to an occupational therapist or somebody who specializes in reflex integration can help you identify which specific reflexes have not integrated and activities that you can play at home with your child to do those reflexes. If you need any assistance with those, please reach out to us at JLD Therapy and we'd be happy to help you identify which reflexes may be unintegrated and how you can work on those at home. Thank you so much.